Hello,
Hello.
my name is Tyler. What's your name?
Eric.
Eric. Hi, Eric.
Eric Wang.
Eric Wang. Hi. We're going to be going through a full, comprehensive health review and health history for your assessment today, okay? It's going to take hopefully less than an hour. I'm going to ask you a lot of different questions pertaining to your health history and your health now, okay?
Alright.
So you said your name is Eric. Is that
Yeah.
E-R-I-C?
E-R-I-K.
E-R-I-K.
Yeah.
Wang, W-A-N-G.
Yep.
What's your cell phone number?
248 342 4414.
And what's your address?
2661 Winter Park Road. Rochester Hills. Michigan.
Zip code.
48309.
Okay. Birthday?
January 3rd, 1994.
And birthplace? City?
Rochester Hills.
Rochester Hills.
Yeah, Crittenton Hospital.
So that makes you 25.
Mm-hmm.
And are you male?
Yeah.
Are you married or single?
Single.
What's your occupation? Job right now?
Yeah, currently I work at a nutritionist place.
Okay, like a nutrition assistant or something?
Yeah.
Okay.
Mostly clerical stuff.
Okay. And what race are you?
Caucasian and Asian.
And who's your employer? Like technically, is there a company name?
Live Clean Nutrition.
Okay. Okay, so you're here for a full health assessment, right? Is there anything else that you're wanting to address today?
No, that's it.
Okay. How would you describe your present health?
Pretty good. No complaints.
Okay. So no illnesses or anything that's bothering you right now? Okay.
Really.
Anything recently within the last few weeks?
But other than that, nothing out of the ordinary, I guess.
Okay. All right, so we're going to move into your past health. You described your general health, okay, good with no complaints, unremarkable other than, seasonal allergies. So you'd say you're in pretty good health for a 25-year-old?
Yeah.
Okay. Any childhood illnesses?
Asthma.
Okay. Anything else?
Mm-mm.
Okay.
That's it.
Do you still have asthma?
Yeah, but it's pretty well under control.
Okay.
I guess I should have mentioned that.
That's okay. Do you take albuterol or a steroid for it or anything?
I haven't in a really long time. I have an inhaler, but
you do have one
I
prescribed?
just have a rescue one. And
Okay.
I haven't used it in a really long time.
Okay, great. Any accidents or injuries? Any accidents or injuries, excuse me?
Mm-mm.
No? No broken bones? No car accidents? Anything like that? Good.
No.
Any chronic illnesses besides asthma?
No.
No skin conditions, no liver conditions?
No.
Good. Good. Have you ever been to the hospital before?
Yeah, when I was a little kid, just for asthma attacks, I think twice, but
Okay.
once
Were you
for sure.
Okay. Did you go to the ER for that?
I don't even remember.
Okay.
Too
Do you
young.
do you remember if you stayed at the hospital or anything like
Yeah,
that?
I stayed overnight. I
Okay.
believe. Must have just been one night.
Okay. Do you know which hospital?
I think it was Crittenton, but it could have been Beaumont.
How old are you when it happened? Do you remember?
Probably 4 or 5.
Okay. Have you ever had surgery before? Ever?
Other than wisdom teeth.
Wisdom teeth? Nothing else?
No.
Okay. You are male, so we're going to skip the OBGYN section, okay? Are you up to date on immunizations?
Yes.
Okay. Have you got a flu shot this year?
Not yet, but I plan on it.
Okay. What about
Better get
tetanus?
on that.
Have you had a tetanus shot recently?
No, but I'm up to date on it.
Okay.
I don't think it was recent, but I had it checked. So
Okay. When was your last physical or last time you saw your family doctor or anything like that?
probably a month ago, maybe a little more than a month and a half.
Okay. I cannot spell today. You said you have seasonal allergies. Do you have any other allergies that you know of?
Yeah, to some animals, but it's fairly under control. I used to work with horses, and I've got 2 dogs, so
Mm-hmm.
I
So
don't really have much of an issue with them.
okay.
As long as I'm not shoving my face
In and
their fur
around
or
them.
something.
Yeah, sure. But there's no overt issues that you worry about with allergies pertaining to animals or food or anything like that?
No.
Okay.
Just runny noses are the worst.
Okay, but that's controlled.
Mm-hmm.
Okay. And you take albuterol, but only when necessary, and you haven't used it in a while.
Right.
Okay. Do you take any allergy meds, like for your seasonal allergy? No?
I
Okay.
used to, but even that I've kind of stopped.
Okay. Okay, we're going to go into your family history a little bit. If you could, describe your family, like your mom, if you have a mom and dad, and then their parents on each side.
All right.
Okay? So, we're going to start. Do you have any siblings?
Yeah.
Okay.
I've got 1 sister.
Okay. How old is she?
29.
Okay. Does she have any health issues that you know of?
No, she's in pretty good health.
Okay. So no high blood pressure, no blood disorders, cancer, asthma. Does she have asthma like you, or
No.
any allergies like you? Okay. So you only have 1 sibling?
Yeah.
Okay. Tell me about your parents.
My dad
Mm-hmm.
he had a kidney replacement,
Mm-hmm.
and so that comes with a lot of symptoms, I guess. But other than the kidney replacement, his health is pretty good. I think he has high blood pressure,
Mm-hmm.
but other than that, his health is pretty good.
Good. So nothing besides the kidney disease and transplant and hypertension for him?
Yes.
Okay. How old is your dad? Do you know?
I should know. I think it's 57.
Okay. All right. Does he have any siblings?
Yes. He's got one brother.
Okay. So your uncle?
Yeah.
Okay. How old is he? Do you know?
Younger, but I don't know his age.
Okay.
And I don't know if he's got any health issues.
Okay. Now tell me about your mom.
My mom is in pretty good health. She had depression.
Okay.
Or was diagnosed with depression, but that's in control. So other than that, she's good.
All right. No, any other neurologic issues, seizures, or anything like that with her? No high blood pressure, no stroke, no diabetes, or anything like that?
No.
Good. How old is your mom?
54, I believe.
Okay. Does your mom have any siblings?
Yeah, she's got a bunch.
Oh, okay.
But she has 4 brothers, but they, I don't know any of their health history really.
Okay.
She has 3 sisters.
Okay.
I guess just for the sake of organization, I can name 2 of them. One has, I'll name 3. Barbara has good health, so she's, no issues there.
Okay. Here, let me stop you for just a second. On that, out of the 8, where does your mom lie?
She's the youngest.
She's the youngest?
Yeah.
Okay. All right, that helps me a lot. Okay,
Yeah,
so you were talking about Barbara. Is she the oldest, or out of the 3
out of the
sisters?
3 sisters, she's the second youngest.
Barbara is.
Yeah.
Okay, so she's the one just older than your mother.
Yeah.
Okay. Okay. And you were saying what about her health history?
So hers is completely good.
Good.
No issues.
Mm-hmm.
She's actually a nurse.
Oh, nice. Wonderful.
Her oldest, my mom's oldest sister also had depression. That's Deborah.
Okay.
And then other than that, to my knowledge, she's fine.
Okay.
And then the second oldest sister, Reba, passed from, she died from cancer. I believe it was breast cancer.
Okay.
It's a big family.
Yes,
side.
it is. Yes, it is. My mom's side is also quite large compared to my dad's. Okay. And you said you don't really know too much about the 4 brothers?
No.
Okay.
And nothing about their health histories.
All right, that's fine. Can you tell me about your mom's parents?
Yeah. Well, my grandma died before I was born, so I don't.
Okay. Do you know what she died
anything. No.
of? Okay.
My grandpa died, and I think, he was 91 when he passed, so it was, I don't know if there was one specific thing, but he was, up until he passed, he was in relatively good health for someone of his age.
Mm-hmm. Good.
So I don't know if there'd be anything I could list as a health,
Okay.
a notable health thing. On my dad's side, my grandpa he also passed. He had dementia or Alzheimer's.
Oh, okay. Hold on one second.
And dementia. Sorry.
No, it's okay. He also passed from dementia, you were saying?
Yeah.
Okay.
Well. Yeah.
Well, he had dementia. You
Had
don't know if he
dementia.
passed from that?
Right.
Okay.
And my grandma on my dad's side is in very good health.
Oh, excellent.
Yeah.
Okay. So I'm just going to go through a list of things, and if your family members have any of these, if it sparks anything, we'll add it to the list. Okay.
Yeah.
Do any of your family members have any of the following? Heart disease? That you know of course.
Right. No, not that I know of.
High blood pressure besides your dad?
Not that I know of.
Okay. Stroke? Any history of stroke?
Mm-mm.
Diabetes?
No.
Blood disorders?
No.
Breast or ovarian cancer besides your mom's second oldest sister, Reba?
I mean, I've got some cousins on my mom's side, but
Okay.
that's
We won't worry about
Yeah.
those, but any of your immediate family?
No.
Okay. Sickle cell anemia?
No.
Arthritis?
My mom actually has very slight arthritis. It's nothing that I think it's like just in her finger,
Okay.
so it doesn't, it's not an issue
Sure.
at this moment, anyways.
Allergies?
My dad actually has allergies.
To what?
Animals or just seasonal.
Okay.
Some animals. And seasonal.
Asthma?
Mm-mm. I'm the only one.
Obesity?
No.
Alcoholism or drug addiction?
No.
No, besides your mom, you mentioned she had depression, and you mentioned your mom's oldest sister also had depression. Does anyone else that you know of
No.
have a mental illness? Okay. Any seizure disorder?
No.
Kidney disease? Besides your dad?
Yeah, my dad.
And he had the transplant, right?
Yeah.
Which kidney, right or left? Do you know?
No.
Okay.
No idea.
Tuberculosis?
Mm-mm.
Okay, great. We're going to move on from that. We are going to start now, focus specifically on you and do a full, body systems review for you. Okay? We're going to start with your general overall health state. Do you know your present weight?
Not entirely. It's
Sure.
I mean, it fluctuates. So it's
What was the last
it's between 160 and 150.
Okay.
Pretty.
Last time you weighed
consistently.
yourself, how much do you weigh?
I think it was low 150, so probably 151.
Okay. Any significant gain or loss in weight recently?
No.
Any significant change in your diet recently? Okay. Any fatigue or weakness?
No.
Okay. Fever?
No.
Chills? Night sweats? Okay, good. We're going to go over your skin. Do you have any history of skin disease?
No.
Eczema, dry skin, psoriasis, or anything like that?
I mean, sometimes my skin is dry, like my hands.
Excessive dry,
Yeah.
really excessive dryness where it doesn't go away, or if you've sought
Not
health
Not
professionals.
really. I mean, just like in the winter, and I used to work at an assisted living facility, so you're, washing your hands all the time.
Sure.
So sometimes they get a little bit cracked, but using lotion usually, or consistently using lotion after you wash your hands helped. So it wasn't like a huge issue that I had to go to the doctors for or anything.
Okay. Any color changes in your pigment or like skin color changes that you noticed recently?
Mm-hmm.
Okay. Any change in the size of a mole or color of a mole or anything like that?
No.
Any itchiness anywhere that you know of? Anything really itchy recently?
Mm-mm.
Okay. Any excessive bruising?
No.
Any rashes or any lesions on your body that you know of?
No.
Okay, good. We'll talk about your hair. Any recent hair loss? Any recent hair gain, like a lot?
No,
No changes in your hair that you've noticed? No changes in texture or anything like that that might seem different to you?
not recently. I mean, when I was much younger, it was straight, but
Sure. I just got curly now, but nothing over the past year.
no,
Okay. We'll go over your nails. Any change in your nails that you've noticed? Change in shape, color, or brittleness? Okay. Now we'll go over your head. Um, any unusual headaches or really frequent headaches?
nothing too frequent. I mean, I've had them every now and then, but it's not like daily or
Okay, not
not
excessive.
even weekly, I would say.
And if you take anything for it, like Tylenol or ibuprofen, or just drink water.
Usually I just try to drink water. If it's really bad, then I'll do Tylenol. But it's
Sure, and it'll go away usually.
Yeah.
Okay. So no persistent headache. Do you get any dizziness or vertigo at all?
No.
Okay. Have you ever had a head injury?
No.
Okay. We're going to go over your eyes. Do you have any difficulty with vision or eye pain?
No. I mean, I've got glasses and contacts, but
Okay. So it's correctable.
yeah, and there's no pain.
Okay. So no blurriness or blind spots that you've noticed?
No.
No double vision? No redness or swelling in your eyes? Okay. No glaucoma or cataracts?
No.
Have you seen an ophthalmologist before?
Yeah.
Okay. And they say your eye health is...
Yeah, it's all good, other than, being shaped weird. As in, just for glasses. I mean,
Okay.
not like...
But nothing that interferes with your daily
No.
living
No.
or being able to see?
No.
Okay. All right, so we're going to go on with your eyes. Do you have any earache or discharge recently?
Mm-mm.
Any infections? Do you get any ringing in your ears?
No.
Do you ever feel like you're off balance or feel like you can't balance appropriately walking?
No.
Okay. Good. They're all good. For your nose and sinuses, any recent discharge that you've noticed? Any excessive bleeding, like bloody noses that come on often?
No.
Okay. Do you get frequent colds, like sinus colds? No. Any sinus pain?
No.
Okay. I don't know. Any obstruction in your nose or anything like that?
Not really, no.
Good. We talked about that you get the usual or the occasional allergies and hay fever, right?
Yeah.
You get runny nose. And
Yeah.
sometimes, if anything, just blow your nose.
Yeah, but even that is fairly rare. I mean, when I was younger, it was a lot worse, but now
Sure.
it's...
And it'll go away on its own. Or
Yeah.
you take an allergy medication, it'll go away. Okay. Any changes in your sense of smell?
No.
Okay. Now we're going to go over your mouth and throat. Any mouth pain or pain in your teeth, sensitivity in your teeth?
Not really. I guess the sides are a little sensitive to cold, but I think that's maybe normal.
Okay.
Hopefully.
Do you have any cavities or root canals?
I had one, but it was filled.
Okay. Is there any pain around
Okay.
that or sensitivity around that area?
No.
Okay. Any excessive bleeding in your gums or anything like that? Do you have any toothache?
No.
Okay. Any lesions or cold sores or anything like that? Okay. Do you have any difficulty swallowing ever?
No.
Okay. What about difficulty speaking? soreness in your throat or anything like that from speaking?
No, not really.
Okay. Right. We'll go kind of more through your neck now. Any pain in your neck anywhere?
No.
Any limitation in being able to move your neck all around, up and down, left and right?
No.
Okay. Any lumps or bumps or any swelling that you've noticed in your neck?
Not that I've noticed.
Okay. Any tenderness, like on the sides where your lymph nodes are, or anything like that?
No.
Okay. And I don't see any goiter. Do you have any? And you didn't mention that you have any thyroid disorders or anything.
No.
Correct. Okay. Even though you are a male, we're still going to go over, your breast tissue, because males still do have breast tissue and they can have similar problems as females. Do you have any pain in your chest?
No.
Any lumps or nipple discharge or rash?
No.
No. Is there any history of a breast disease in your family?
Yeah, breast cancer.
Breast cancer.
That's
for your Aunt Reba,
yeah.
right? Okay. Okay. Did she have surgery or anything that you know of before she passed?
No, I'm not sure if she did.
Okay. So in your axilla, your armpit, is there any tenderness, lumps, bumps, or swelling in your armpits?
Mm-hmm.
Okay. Any rash or excessive sweating?
No.
Okay. All right. Now we're going to go over your lungs. Any history of lung disease besides the asthma that you had mentioned earlier?
No.
No COPD?
No.
Have you ever had pneumonia or tuberculosis?
No.
Okay. Any chest pain with breathing?
No.
Okay. Wheezing or noisy breathing?
With asthma,
If you were to experience symptoms, then you would get wheezing.
Yeah, but
okay, but not anything recently.
Not constant.
Anything recently?
Mm-mm.
Over the past few months, have you had any difficulties with asthma?
I guess but nothing. Just stuff that.
How long ago?
I feel a little bit of a tightness, and then it's it's gone within an hour.
Okay. How long ago was that?
Probably a couple months
ago
or so.
Okay. Did you get shortness of breath at all?
No.
No. Okay.
No, just
the chest tightness that you mentioned a few months ago.
Mm-hmm.
Okay, but no shortness of breath or anything recently? Okay. Any recent cough?
No.
Productive cough or anything like that?
Mm-hmm.
No. Any coughing up blood or anything like that?
No.
Do you know, to your knowledge, if you've been exposed to any toxins or pollution?
Not to my knowledge.
Okay. Have you ever had a chest X-ray?
No.
Okay. All right, now we're going to go on to your cardiovascular system. Any pain in your... you mentioned that you didn't have any pain in your chest, right?
Right.
Good. Does it ever feel like your heart might be fluttering? We call them palpitations. Any weird feelings in your heart?
No.
Okay. Have you noticed any discoloration of your skin where you turn blue or anything like that?
No.
Okay. You mentioned the chest tightness, and you also mentioned that you don't really get like a difficulty breathing ever if you're exerting yourself.
Say that again. Sorry.
Do you ever get difficulty of breathing when you're exerting yourself?
Like working out or something?
Sure. Yeah. Or going upstairs at work, or...
No, working out or, if I'm doing something high intensity, then
you'll
sure.
feel like, oh my gosh, I can't breathe.
Oh no, sorry.
No, it's okay.
I mean, I
it's
breathe
okay.
heavily, but no.
Difficulty in
nothing
breathing,
out of
like where you are concerned that you're having
No.
trouble breathing.
No.
Okay. Okay. You just had to clarify there.
Right.
It's normal to, of course, get out of breath when you're running
Right.
or something like that, but that's a little different than becoming concerned where I can't catch my breath.
Right.
I need to actually stop and not do anything because I'm worried that I can't breathe. That's what I'm talking about.
Right. Yeah, no, I don't.
That kind of, okay.
No issues with that.
So then, if you ever lay down, do you feel like you can't breathe when you're laying down?
No.
Or what about at night? Do you feel like you can't breathe at night?
No.
Do you pee a lot at night?
No.
Okay. Do you notice any swelling in your body anywhere?
No.
Okay. Do you have any history of heart murmur?
No.
Hypertension?
No.
Coronary artery disease?
No.
Or anemia?
No.
Have you ever had an electrocardiogram? ECG?
I don't think so.
Okay. Have you ever had any blood tests pertaining to your heart?
No.
Okay. We're going to go on to your vascular system. Do your extremities, your feet, hands, ears, do they get really cold randomly?
My hands are pretty cold a lot of times, but
Not like,
especially in the winter.
do they get warm if you try to warm them up?
They can.
Okay.
I mean, I've never had it where it's like I absolutely can't get them to warm up, but
Okay.
sometimes it takes more than just rubbing your hands
Sure.
together.
Sure. Any numbness or tingling in your hands or extremities?
No.
Any swelling?
No.
Discoloration?
No.
Any blue or red, like really red or patchy redness on your hands or feet?
No.
Okay. Have you ever had varicose veins?
No.
Okay. Any ulcers or lesions?
Hmm.
Okay. We're going to go on to your GI tract. How's your appetite? Would you say you have a normal appetite?
Yeah.
Okay. You
Pretty good appetite.
every day, and you get enough food every day?
Yeah, for sure.
Okay. Do you have any intolerance to anything?
Not really. No, not that I can think of.
Okay. Any difficulty swallowing?
No.
Do you get heartburn?
No.
Do you have any problems digesting certain foods?
No.
Do you have any abdominal pain?
No.
Do you get any like burning when you eat certain foods or anything like that? No irritation?
No.
Okay. Do you have any nausea recently?
No.
Any vomiting recently?
No.
Do you have any history of abdominal disease, like ulcers or liver, gallbladder cancer, or gallbladder issues, gallbladder stones?
No.
Okay. No hepatitis or anything like that
No.
that you have? Okay. Any jaundice, which is yellowing of the skin?
When I was a baby, but
When you were a baby? Okay. When you were really young, like as an infant?
yeah.
Any excessive farting or
No.
flatulence?
No.
Do you have normal bowel movements?
Mm-hmm.
Okay. Any issues with bowel movements?
No.
Did you say? Would you say if you go, normally like maybe once or twice a day, or once every other day?
Usually once a day.
Okay. Any change in stool characteristics that might concern you?
No.
Any constipation or diarrhea?
No.
Black stools?
No.
Any bleeding? Any in your rectal area?
No.
Okay. Any hemorrhoids that you know of?
No.
for your urinary system, do you pee on a regular basis? Do you pee a lot? Do you feel like you go pee all the time?
No,
Any more so at night?
no. I mean, I rarely do I have to get up at night.
Okay, that's good. So no difficulty there?
No,
Okay. Any hesitancy or straining when you go?
no.
Well, how would you describe the color of your urine?
Usually it's well, pretty somewhat clear, but a little bit yellow, I guess.
Okay. The reason I ask is that if it's really dark or red,
Right.
that might indicate there might be something wrong.
going on.
So you know when you have to go, you're able to control when you go,
Mhm.
right? Okay. We talked about the history of kidney disease with your father. Have you ever had a kidney stone?
No,
Have you ever had a urinary tract infection?
no,
Any issues with your prostate that you know of?
no,
Any pain in like your lower back or your sides, like your flank? Any pain here?
no,
No. Any pain in your groin area
no,
or lower belly?
no.
Okay. With you being a male, we're going to talk about your genital area, okay? Any pain down there?
No,
Any testicular pain? Any sores or lesions that you've noticed?
no,
Any discharge that you've noticed?
no,
Lumps, bumps, bugs?
no,
Nothing. Okay. Have you ever had a hernia before?
no.
Okay. All right. Are you presently in a relationship?
No, not presently.
Okay. So are you in a relationship involving intercourse?
No,
Are aspects of sex satisfactory to you?
they were, I guess. Yeah.
Okay. You're not in a relationship, so I don't imagine we have to ask most of these questions. Have you ever been screened for STDs or STIs?
No,
Okay. Are you aware of any contact with anyone who has been infected with any STIs or STDs?
no,
All right. Onto your muscles and your skeleton. Any history of arthritis or gout?
no,
Any pain in your joints?
no,
Joint stiffness or limited movement?
no,
Okay. Any deformities that you know of?
no,
Any excessive noise moving? Like feel like your bones are cracking or anything like that?
no, not that.
Okay.
Not really.
Any excessive pain or cramps?
No,
Any weakness? Do you feel like you have any trouble walking?
no,
Have you ever been told if you have any gait problems or trouble walking?
no. I guess to go back for cramps, I guess.
Sure.
I mean, I have had.
You've had a cramp before in your life?
Yeah.
Okay, but anything
But,
recently that's
No,
excessive?
and not if I'm just not when I'm just sitting there
Okay.
or something like that.
Okay, do you think if anything brought the cramp on? Like after swimming, after
Yeah.
eating, or
I mean, just
was it just like
working
out of the blue I
kind of
have a
stuff.
cramp?
Probably
Okay.
not getting enough electrolytes or something or water.
Any lower back pain?
No,
Okay. So no limitation of range or movement, pretty much anywhere in your body. You feel like you can stretch okay?
yeah, for sure.
Okay. Now on to your brain. Any history of seizures,
No,
stroke,
no.
fainting?
I fainted before.
You
but
have fainted before. Tell me about that.
was just in class, and I went to the doctor. I mean, no one knows why. I don't know why. It was just in class, and
Sure.
I went to the doctor. They said looked fine. Then I never had that again.
Okay. How old were you? What grade was it? Or just tell me how old were you?
Probably 16 or 17.
Okay. So no history of seizure disorders?
No.
Okay. Any tics or tremors?
No.
Paralysis?
No.
Coordination problems?
No.
Okay. Any sensory dysfunction? Like, do you have tingling, numbness, or problems feeling certain things?
No.
Okay. What about hearing certain things? Are you able to hear normally, would you say?
I think so.
You're able to see normally?
Yeah.
Okay. Do you have any memory issues that you know of?
No.
Any disorientation issues?
No.
Okay. Any changes in mental status that you've known? Any nervousness or anxiety, depression, mood change, or anything like that recently?
No.
Any hallucinations or delusions?
No.
Okay. Have you ever been paralyzed?
No.
Have you ever injured your spinal cord?
No.
All right. Now for your blood. Any blood disorders that you know of?
Not that I know of.
Do you bleed anywhere that you don't think is normal?
No.
Any bleeding into your eyes, your fingers, or your ears that you've ever witnessed?
Mm-mm.
Any bleeding in your mouth?
No.
Okay. Any excessive bruising? Do you get bruises a lot?
No.
Any lymph node swelling, like in your neck or in your armpits or your groin area that you've ever noticed?
Not that I've noticed.
Okay. Have you ever, and I asked you this earlier, have you ever been exposed to a toxic agent or radiation?
I mean, I guess biohazards when I worked at the assisted living place.
Mm-hmm.
But, I mean, there was no incidents with it. I never,
Okay.
got splattered with.
Sure. Have you ever had a blood transfusion?
No.
Okay. Endocrine system. Any history of disease or diabetic symptoms?
No.
Do you no reason for you to go pee all the time, like numerous times a day?
Mm-mm.
Do you feel like you're really thirsty a lot? Like, I'm constantly thirsty?
No, not constantly.
I'm sorry.
Drink water a lot.
I mean, you drink water, but you don't
But I'm not
feel
like,
thirsty. Like, oh my gosh, I'm thirsty. I need to
No.
keep drinking.
No.
What about eating? Do you feel like you are like always hungry?
No.
Okay. You said you have no history of thyroid disease, correct?
Mm-hmm.
Do you have any intolerance to heat or cold?
No.
You said no changes in skin pigmentation or color, right?
Right.
You said earlier that you don't have any excessive sweating.
Right.
Do you feel like the relationship between your appetite and your weight is appropriate?
Yeah.
Have you noticed any abnormal hair distribution? Just a few minutes ago, you said you don't really feel excessively nervous about daily living activities, right?
Right.
Okay. No tremors or tics that you've noticed?
No.
Have you ever went through any hormone therapy?
No.
Okay. Almost done. Now we're going to go on to functional assessment. I'm going to ask about just like things that you probably experience every single day, or at least kind of get a better feeling for your daily living. Okay?
All right.
You doing okay?
Yeah.
Okay. Education. So last grade completed.
I don't know. I'm in this accelerated nursing program.
Okay, which means you have a previous bachelor's degree, right?
Yeah, so that would be the last
What did you major in?
Advertising and graphic design.
Oh, that's fun. Would you say your income is adequate for your lifestyle?
Yeah.
Okay. Do you practice any religion?
Yeah, I mean, I'd say Christian. I'm Christian. I don't go to church, but like I'll read the Bible.
Do you take time for yourself? Do you take care of yourself? Self-care behaviors? When you feel stressed about something, take a day off or anything like that?
Yeah, I mean,
yeah. Good. All right. Some people don't.
Right.
For activity and exercise, how would you describe your day-to-day activity and exercise?
I try to work out probably between 3 and 5 times a week.
Okay. What does that entail?
The place that I currently work it's kind of like it's called headquarters. So I work at Live Clean Nutrition, but it's sort of the same.
Sure.
The owners are the same. It's a family thing, but so it's just it's HIIT, so high intensity interval training.
Okay.
Very high intensity, but it's 30 minutes, so it's fun, and it's nice. I don't have to think about planning out a workout or anything like that.
Sure. Is that like CrossFit?
Kind of, but it's a lot less focus on like hitting heavy weights or something.
Okay.
I think it's a lot safer.
Sure. Yeah, CrossFit's actually really not good for your joints.
Right. It's a similar, your heart rate's up the entire time kind of deal.
Good. Do you need any assistance with, your daily activities?
No.
No assistance like walking, standing, climbing stairs, eating, dressing yourself, going to the bathroom, taking a shower. So you're independent?
Mm-hmm.
What do you do for fun on your time off?
I'll spend time with other people or working out. It's fun. I like to read.
What do you like to read?
Well, now I read a lot of textbooks, but I like H.P. Lovecraft. He's probably my favorite author.
What does he or she write?
Just like On the Mountains of Madness and Shadow over Innsmouth. It's like, I guess
both of them sound intriguing. I just don't know what they are.
Yeah.
Okay.
It's hard to go into. Right?
Sure. For nutrition and elimination, do you know what you ate over the last 24 hours? Eat and drank over the last 24 hours?
Yeah.
Okay. You ate like a few different meals. How many meals did you eat over the last 24 hours?
2. Well, yeah, 2. Well, if you started
so from
Sunday,
today,
just Sunday.
So right now, did you eat breakfast this morning?
Yeah.
Did you eat lunch
so
today?
It would actually be 3.
So did you eat lunch today?
Oh, no.
Did you eat breakfast?
Yeah.
Did you eat dinner last night?
Yes.
Did you eat lunch or breakfast
Yeah.
yesterday?
Yeah,
Which one? Both.
lunch, just lunch.
Okay, so 3.
Yeah.
That's okay. I know it's weird to ask a lot of these questions. And you would say that you went to the bathroom appropriately over these last 24 hours?
hmm
The things that you ate over the last 24 hours, would you say that's normal for you or typical for most days?
Yeah, yeah. I mean,
Who buys your
I'm
food?
fairly standard. I do, and my parents. We kind of trade off.
Who prepares your food? Same?
My mom a lot. I help though.
Okay.
Well, I get yes for dinners. She does a lot, and then other meals I take care of.
Would you say your finances are appropriate for your food intake?
Yeah.
Who usually eats with you at meal times?
My mom.
And when it comes to your nutrition, is there anything else that comes to mind for like self-care and eating foods?
Not really. I mean I do intermittent fasting, which is
Is that like when you don't eat for 16-hour periods or something?
yeah, but it's cause I've learned a lot about it where I work, and it sounds a lot weirder than it really is. I mean it almost feels like cheating because you can just not eat breakfast.
Mm-hmm.
It's just you
You
narrow
only
your
eat.
eating window.
From what I understand is that you only eat for 8 hours in a day.
Yeah.
Right?
Yeah, I mean,
And then-
it varies depending on person, but yeah, I usually shoot for 16-hour
Oh,
or
okay.
the 8-hour eating window.
What would vary? Like you said, it varies per person. Like
Yeah.
some people
I mean,
eat
some
for
people will do.
a smaller window
Yeah.
that they eat
I mean,
for.
I've heard some physicians do or there's some physician that I've read about who just does one
1
meal
hour?
a day,
Oh. It's like,
Yeah.
oh my goodness.
and
Just one meal. Is that
but
one
that's
meal
pretty
like
extreme.
3,000 calories or something like that?
It's probably pretty big.
Oh, wow.
But yeah, and women, for instance, tend to. It's recommended usually that they have a shorter or a longer eating window and a shorter fast period.
Oh, okay.
But it really comes down to personal
Sure.
preference, and a lot of it has to do with if I work, it makes it really easy because you don't eat breakfast, and then you just don't eat when you're at work, which you usually don't do anyways. So
What about for 12 hours?
12 hours might
I
be.
work 12-hour shifts.
Yeah, that might be. It might get
You will too
difficult there,
soon.
yeah. So I don't know about that.
Okay.
But I only do it. Some people do it every week, or every day of the week, but I usually just do 3 days a week.
Okay. Okay. How would you describe your role in the family?
Son.
How do you get along with your family?
Pretty well.
Do you get along with your friends and coworkers?
Yeah.
If you were to have any issues with your life or finances or school or stress, do you think that you would be able to get appropriate support?
Yeah.
Like, there's people that can help you and that you can go to?
Mm-hmm.
Okay. How much time during a regular day do you spend alone?
I don't know, a fair amount. I mean, with classes and work, I guess that cuts it down. But, some days I spend with other people. Some days I spend alone.
Depends on the day.
Yeah.
say being alone is pleasurable or isolating?
I don't mind it. I think I like it. I like other people too, but I can find value in both.
For coping and stress management, do you have any stresses in your life right now?
Just school, and I mean, yeah, really just school, and
Okay.
I guess the setting yourself up for a good career in nursing. But
Do you know
Is
what
that
type of
probably-
nursing you want to do yet, by chance?
I'm leaning towards ICU just because I've had a
Mm.
couple nurses tell me that they really liked it. I like
Mhm.
the the small patient to nurse ratio.
Mm.
'Cause when I was at assisted living, it put so many on.
Mhm.
And I loved all the guys that I took care of, but it was like you just don't feel like you're able to provide good quality care. So I like the idea that you would be able to provide a lot of good care for
Mhm.
a smaller number of people.
Mhm.
But who knows how? I mean, I haven't done clinicals, so who
You never
knows
know,
where
I
I'll
guess.
end
Yeah.
up.
For your coping and stress management, have you had any major changes in the past year?
No.
You talked about how you like to work out, read. Would you consider those things strategies that you use to relieve stress?
Yeah, for sure.
Anything else that you can think of that you would use to relieve stress?
Not really. Sometimes I just lay in bed.
Sleep?
No, I mean,
Lay
I
and
don't
think?
really. I won't. If I'm studying and then I'm like, this is a tough part to study, then I'll just
Yeah.
go and lay down for 5 minutes.
Yeah. All right.
Mostly just procrastination. I don't know if that's really stress management. But I never, I'm not there for hours or anything.
Yeah.
I'll just
Would
be
you
like,
say
"Oh,
those
I
methods
should
are
probably go
helpful?
study again."
Yeah.
Yeah. Yeah, working out is good.
Okay.
For sure. I think that's probably the best.
For your personal habits, do you intake caffeine?
I do for classes,
Yeah.
but
Like
I
coffee,
mean,
tea, or pop, or anything like that?
coffee. I drink coffee only
How many times per
2
day?
days a week,
Oh.
just because our nursing program classes are 9 to 2:30, and it's a lot of. I'm not used to sitting for so long, so I just drink
Mm-hmm.
coffee on those 2 days.
Mm-hmm.
But other than that, I really don't drink much caffeine at all.
I'm the opposite. Do you smoke cigarettes?
No.
Do you drink alcohol?
Occasionally, but pretty infrequently.
Socially, did you usually drink what are the occasions usually?
Yeah, only if I'm with friends or something.
Okay. When was the last time you had alcohol?
2 weeks ago.
Okay. So, what was that, the 16th?
Well, I don't know if it was exactly 2
Okay,
weeks,
I'll just
but
put 2 weeks. 2 weeks prior. Do you know how much alcohol you drank?
just like 2 drinks.
Sure. Over the last 30 days, how many times have you had alcohol?
Probably only 2 times, or maybe 3 times.
Okay.
I'd say.
Everyone told you have a drinking problem?
No.
Ever use street drugs?
No.
Marijuana, cocaine, heroin, LSD,
No.
amphetamines?
No.
Abused prescription painkillers?
No.
Barbiturates?
No.
Ever been in treatment for drugs or alcohol?
No.
Okay. Environmental hazards. Housing and neighborhood, the type of structure that you live in, Do you know your neighbors? Do you live? You live with your mom. Do you know your neighbors?
Yeah,
Are they
yeah.
friendly?
Very.
Okay. What type of structure do you live in?
Like a building.
Yeah, I think it's asking like house, apartment, or
yeah,
condo or
house.
something like that. Okay. Do you feel safe?
Yeah.
Do you have adequate heat and utilities?
Mm-hmm.
Do you have access to transportation?
Yeah.
Do you volunteer in community services?
I used to. I haven't in a while.
How long ago?
Probably like. Oh well. Yeah, like 2 years ago.
Are there any hazards at your workplace or home?
No.
Do you use your seatbelt?
Yes.
Have you been to or traveled to or had residence in any foreign countries?
I've been to Canada.
When did you go to Canada?
Probably when I was like 13 or something.
Younger?
Yeah.
Not recently?
No.
Any military service?
No.
Any intimate partner violence, domestic violence?
No.
Do you feel safe?
Yes.
Ever been physically or emotionally abused by someone that you know?
No.
Ever been hit, slapped, kicked, pushed, shoved, or otherwise physically hurt?
No.
Ever been forced into having a sexual relationship?
No.
Ever been afraid of someone that you live with or someone that you had a relationship with?
No.
Okay, for occupational health, how would you describe your job? I know you kind of went over it a little bit earlier. How would you describe it?
It's good. It's a lot of just clerical work, but I'm working with the nutritionist. I've learned a lot about, or a fair amount of stuff on nutrition.
And this isn't an
place.
assisted living facility, right?
No, sorry, that's
okay.
I used to work in it.
You used to work there?
Yeah.
Okay.
Now
okay. Gotcha.
It's a separate place.
Gotcha. So I just put clerical work with nutritionist.
Yeah.
So you said earlier that you don't really have any overt exposure to health hazards at your job, right?
No. That's correct.
Okay.
I do not have any.
Okay. Sorry, I worded that weird.
No, you're all right.
So is there any equipment at work designed to reduce your exposure to hazards?
Yeah. No, there's not really.
There's not really hazards,
Yeah,
so there's really no
hazards.
need for equipment. Okay.
It's a really clean place, I guess.
Sure. I'm just going to put NA for these. And we kind of went over this right kind of at the beginning. How would you define your health? Or no, excuse me. How do you define health?
I'd say your state of being.
Do you have any concerns?
No, not really. I hope I don't break my leg in the next day or something, but nothing that really I dwell on or anything.
What do you expect will happen to you in your future? I'm having difficulties reading today. What do you expect will happen to your health in the future?
I hopefully it'll stay the same or get even better. But I'd be happy if it just stays the same. But I guess far into the future it probably won't. But
Do you have any health goals?
not really. I mean, other than maintaining a healthy lifestyle, I guess there's always room for improvement in that respect.
And what are your expectations of nurses and physicians?
I think their job is to do their best to, I guess they have two different jobs, but nurses should be doing their best to care and comfort those that are suffering, and physicians are, it's a very similar. I guess it's similar in that respect. They just kind of look at different angles.
Okay. Well, Eric, that concludes our interview. We made it through.
Awesome.
Congratulations.
Thank you.